Hi, I'm Brendan McLaughlin, the Programme Director for Working for Wellness. Trying to find work, you can come up against a particular barrier which is invisible and not talked about enough. 1 in 4 people will experience a mental illness, but 1 in 4 people will not talk about their experience. And a key factor in this is stigma. Stigma is about prejudicial attitudes that people hold about mental illness and those who've experienced it. How does stigma affect people? There are 2 different ways. Firstly, it's about other people. One of the reasons people are reluctant to talk openly about their experience is the attitudes that they think other people hold about those who've been through them. A recent survey supported this, with 56% of people saying they would not employ someone who had openly admitted experiencing a mental illness, even if they were the best person to do the job. But also people are affected by stigma themselves, views they have about themselves. This is often called self-stigma. This can eat away at people's self-esteem and their beliefs in what they are capable of doing. It can discourage them from applying for a job, and even if they do, they may then perform badly at interview. It can also get in the way of relationships, so that someone might not share their experiences with their friends and family, which might in fact help them with their mental health. But to go back to the attitudes of others, the manifestation of these is discrimination. That is the behaviour which demonstrates that perceived difference from one person to another, usually based on poor knowledge and prejudice. It can mean someone doesn't get shortlisted because they've disclosed that they've experienced a mental illness. And again, that recent research, 92% of people said they would not disclose they had a mental illness when applying for a job because of the impact that they would think it would have. I think this just illustrates how widespread and ingrained stigma is, and it's therefore unsurprising that discrimination results. So people might not get a fair shot at jobs, they might not apply for jobs because they think they'll not get a fair deal, and people will lie in application forms to try and get a job. What can we do to challenge this? The first obvious route is legislation. In the UK you have the Disability Discrimination Act, which was amended in 2005, which was better in terms of protecting people with experience of mental illness through that amendment. But also, what can we do in our day-to-day lives? We all experience stress. If we didn't, we wouldn't achieve anything, and stress can help us to perform better. But also, we've probably all experienced the difficult levels of stress where we find that we are performing worse as a result. It's a very common experience which we're happy to talk about, and we can use such conversations to start broaching the issues of mental health, distress and mental illness. I'm sure we've all seen people at work who have become distressed for whatever reason, angry, tearful, complaining about their boss and the stress they're putting them under. Well, if we can start to use those conversations as opportunities to talk about more sensitive issues. People now are often worried about redundancy, personal debt and the impacts of the recession upon them. All these provide opportunities for conversations in which we can talk about our mental health. There's the old saying, a problem shared is a problem halved, and I think that's very important in terms of helping to get through mental health issues. Another thing is mental health first aid. This is something which was originally developed in Australia, but Working for Wellness is supporting people to undertake this training in London, in businesses and in other settings. What they found in Australia was that it gives knowledge to people, but also it does also start to challenge some of the stigma. Also, we must not forget managers. Managers are often under a lot of pressure, and a lot of the way they behave will influence the way that the people who work for them behave. They may not understand the concept from the Disability Discrimination Act about reasonable adjustments. So we need to be very clear that we need to help managers to be more human themselves and to treat their staff as humans and understand the issues that they go through. In small businesses, for example, often the manager is also the boss and owner of the firm, and with a small staff they develop those personal relationships. They will make reasonable adjustments to help people in times of difficulty without knowing that's what they're called, but just thinking they're helping out an individual who's going through times of stress and difficulty, and they want to keep them working because they value them as a member of their staff team. It's helping people to be human and respond to them as humans that's crucial.